The extraction of a tooth is performed. The patient is a 56-year-old Japanese female. The maxillary left molar is extracted due to periodontitis. It is known that the extraction of a tooth often causes resorption and deformity of alveolar bone. We now have a new product available for augmenting the growth of new bone in the extraction sockets. Foundation is offered in two different sizes, small and medium, in plug form. It fits all extraction sockets. It is individually packed in a sterile plastic container, which is sealed in an aluminum package. Contents are sterile and non-pyrogenic. Foundation should be selected in a slightly larger size than the socket to be filled to completely fill the socket without any void. Two pieces of small-size foundation are used in this case. Before filling the socket with foundation, the edge of gingiva was removed from the inside of the socket to the top of the alveolar bone, and unhealthy granulation tissue in the socket was curetted. Pooled blood in the socket should be wiped off. The peripheral gingiva of the extraction wound should be closed with sutures in order to prevent dislodgement of foundation. A few days post-operation, the surrounding cells and capillaries begin to infiltrate into foundation. Peripheral gingiva extends onto it, and the extraction surface closes in a few weeks, followed by growth of new bone at accelerated pace in the extraction socket. Wound healing following extraction is observed in a beagle. The mandibular left teeth are extracted. Foundation is filled in the extraction sockets. This is a soft radiograph of 1 week post-operation. Soft radiograph after 1 month shows soft tissue healing. Bone density in the affected site is improved in 3 months. Let's look at a tissue sample. The extraction socket filled with foundation can be seen in between the alveolar bone and soft tissue. The tissue sample of 1 week post-extraction shows the fibers of foundation. 1 month later, numerous cells are infiltrated into foundation at the center of the tissue sample, which is expected to form new bone. 3 months later, foundation is mostly replaced with new bone formation. The extraction socket is filled with augmented bone. What is the inner structure of foundation? Let's examine a section of foundation under a scanning electron microscope. Foundation is made of atelocollagen from bovine dermal collagen to minimize antigenicity. The atelocollagen has been cross-linked by heat treatment in order to achieve biocompatibility. Foundation appears to have a sponge-like structure made of atelocollagen. Foundation consists of fibrillar and heat-denatured atelocollagen. It is processed in a bullet shape for easy placement into the extraction socket. Foundation absorbs blood and fluids in the extraction socket and becomes softer. What actually occurs within the socket? To answer this question, a thin section of foundation is co-cultured with a bone fragment from mouse calvaria. Bone fibroblasts and osteoblasts infiltrate the hydrated fibrillar atelocollagen fibers of foundation, which provide scaffolding for the cells in the extraction socket. Heat-denatured atelocollagen fibers now stimulate accelerated bone growth into the scaffolding. Infiltrated cells in foundation show division growth simultaneously. Foundation becomes a matrix for these cells to spread gradually. Foundation fibers are absorbed and eventually replaced by regenerated bone tissue. The cells attached to foundation fibers form new bone. At 1 week co-culture, foundation is completely covered by cells and can no longer be seen in its original shape. After 3 weeks of co-culture, a red stain specific for alkaline phosphatase is used in order to provide a marking of bone formation. Let's examine the change in foundation under a scanning electron microscope. The structure of foundation changes after 2 weeks of co-culture. This magnified view demonstrates that foundation is covered with various cells from new bone formation. Residual foundation fibers remain among the mass of cells. An area of osteoblast layering indicates new bone formation. Following cell invasion, vascularization occurs and bone tissue is regenerated. Finally, the extraction site is healed. The effectiveness and safety of foundation has been proven through controlled clinical studies in Japan. The results indicate that foundation was effective in 105 out of 114 cases examined by 7 institutions. The effective rate is 93%. No side effects or related complications were reported. This is the scene of a tooth extraction from a 73-year-old diabetic patient. The extraction site is healed 4 weeks after foundation was inserted. Foundation is very effective in promoting new horizontal and vertical bone augmentation in the extraction socket. Foundation is completely biocompatible.